Welcome to Health and Wellness Thursday. Today we are fortunate to have a guest speaker with us, another one, Caroline Sarafin, talking about preparing for the holidays. I want to acknowledge our donors, the Ken Johnson family in memory of Joan Brierton Johnson and the foundation support for this program. Next slide. I'm Rebecca Crane-Okada, and I am the program manager for our clinical support services in the breast center, and Alston Novak is our assistant for all of this and hosted last month's. And then Caroline Sarafin, who is a social worker here with the oncology team, and we're thrilled to have her presenting today. So I say take it away, Caroline.
Thank you so much, Becky. I'm so happy to be here today. Again, my name is Caroline Sarafin. I'm one of the Outpatient Oncology Social Workers here at St. John's Health Center, and I am so happy to be here today to talk about preparing for the holidays. So some of the objectives we're going to cover today are common stressors that may arise during the holiday season. Then we're going to get into exploring some coping ideas together. And then we're going to talk a little about the art of finding gratitude amid stress. So just to start off with a statistic, the American Psychological Association found that more people in the United States find their stress increases rather than decreases during the holiday season for a variety of reasons. Lack of money for gifts, lack of time to shop and cook, and the overwhelming commercialism and hype of the holiday season can all increase the amount of stress felt during the holiday season. So then, just because of my oncology background, I'm going to get into some of the additional stressors some of our patients may feel during an already very stressful time of year. So to get started, some of the most common holiday season stressors are one, family conflict. The holiday often involves spending time with family members, which can sometimes lead to conflicts or unresolved tension. Holidays can be especially hard for individuals who have strained relationships with family members or have experienced loss or trauma during this time of year previously. Another big one that we hear about from patients is financial stress. Many people feel increased pressure to spend money on gifts, decorations, travel, and social events during the holidays, which can lead to financial strain and anxiety, especially if you are on a fixed income. And as many of you may know, adding in any bills for medical situations can increase our financial toxicity. So this stress during the holiday season can really feel like a lot to manage when you're managing the stress of the holidays in addition to medical bills or whatever it may be. Another big one is societal pressure. There can be societal pressure to create the perfect holiday experience and season with unrealistic expectations set by society, media, and even one's imagination. Unrealistic expectations can lead to feelings of stress, inadequacy, and disappointment if your holiday does not go as exactly as planned. So I think a lot of times on social media or just, all around us, it may feel like everyone else's holiday is going perfect and we feel like we're facing all this stress and maybe family conflict or financial stress. But I always remind patients that a lot of times the things we see on social media and around us, people tend to only share the highlights of their holiday season rather than some of the stressors that they may be experiencing behind closed doors. So that's always helpful to keep in mind if we are feeling some of that societal pressure. Another aspect of the holiday season I talk a lot about with patients is seasonal affective disorder. The holiday season does coincide with less sunlight and colder weather, which can contribute to seasonal affective disorder, a type of depression, which can make it even more challenging to navigate the holiday season. So the holiday season can be stressful in itself. Then when you add in a medical stressor in addition to all of these things, it can feel like a lot. And as I kind of touched on, the holiday season can just be an increased time of stress, even though around us. It should feel like this is a time for celebration and spending time with loved ones. However, if you are going through any medical situation, it can bring about more feelings of sadness, as patients may be facing a challenging and uncertain time in their lives and don't really feel up to celebrating. It can be hard to see everyone around you appear happy while you're really not feeling like yourself or feeling up to gatherings or celebrating. The holidays a lot of times can be a reminder of grief as well. It can bring about feelings where we are reminded that we don't have certain loved ones with us anymore, or we can be grieving our own situation, such as medical changes or whatever it may be. So there can be a lot of different triggers that may arise during this time of year. Another big one I hear from patients is perhaps if you are undergoing any sort of treatment, you may have to follow certain dietary guidelines, which can make it difficult to enjoy traditional holiday meals and treats that maybe you once enjoyed. Patients also may be facing physical limitations where they're experiencing some sort of side effects from treatment, such as fatigue, pain, nausea, and weakness, which can limit their ability to participate in holiday activities or travel to be with their family or friends. These side effects can make it challenging for patients to keep up with the demands of holiday preparations and activities. And another one I talk a lot about with patients is any changes in appearance that may be happening if you are undergoing any chemo or radiation during the holiday season. Um, Things such as weight loss or weight fluctuation may be a side effect, and patients do report that sometimes this makes them more anxious or uncomfortable to be in social settings as often. And a lot of times during the holiday season, we are attending more social gatherings. So finding ways to navigate these side effects and ways to um, make you feel confident, such as, finding a head covering or wig that makes you feel good if you do have social gatherings to attend during this season. So those are just some of the stressors or main stressors that we talk with patients about during this season. And next, I want to get into some ways we could potentially cope with some of these stressors, and to just keep in mind that coping strategies do look different person to person. Everyone copes in their own way. So some of these may feel like a strategy that would be helpful for you, while others may not resonate as much. So just calling that out, that we all do find different ways of coping more helpful. So just to start off, maybe something that would be helpful is thinking about modifying your traditions this year, if that feels right. Again, yes, holidays can be a time of tradition, joy, hope, and gathering, but also a time of stress, as we just went over. You may need to modify or adapt holiday traditions to accommodate your energy levels and physical limitations this year. You can explore alternative ways to celebrate, such as maybe asking a family member to host, or have a smaller gathering this year than you typically do, or maybe participating in a virtual celebration rather than traveling feels right this year. If you are feeling financially stressed, there are still many ways you can give heartfelt gifts without breaking the bank. Consider handmade gifts or baking. Even writing a thoughtful letter to a loved one could be a great gift. Framing a photo, or just maybe even going on a short walk or spending time in a special way with a loved one could be a way that you show you are thankful for someone this year. A lot of times the thought really does count rather than the monetary value. So just keeping that in mind if you do need to modify any presents this year or are feeling the effects of financial distress. Another thing that you could consider is maybe suggesting a potluck if you still want to host but don't have the energy to cook for everyone. So if everyone brings a dish, it will take some of the stress off of you to have to cook for everyone. So if everyone's kind of pitching in, that could be a better way to split up the tasks of the holiday season. Or you could even consider co-hosting with a family member or friend, so you have some help and don't have to do everything alone. The next one is identifying your support system up front before the holiday season. Sometimes that can feel really helpful because if you are to start feeling down during the holiday season, once we are already feeling down, it can feel tedious to think about who you may want to call or who you could reach out to for help. So a lot of times I tell patients maybe going into the holiday season and writing down 2 or 3 people you can reach out to if you start to feel stressed or sad at any point, can be really helpful. So you just have those names already identified and can make a call if you need to, or can ask for support proactively if you feel that would be helpful. If you can't physically be present with your loved ones, you can connect through video calls or phone calls. We do have access to do that. And I know some people do have Zoom fatigue after the past few years, but if this is an option or something that would make you feel connected in a special way, I encourage you to do so. You can still really make a point to share stories virtually, exchange holiday wishes, and feel the warmth of your family and friends during this time. So that can be an option. It can be really hard for many of us to ask for help, and I do recognize that, but most of the time your loved ones truly want to help if you're feeling stressed during this season. So I always encourage you, if someone that you love is offering support, give them a task because it can really make them feel good to know that they are helping you. So that is always a good thing to keep in mind. And just lastly, remember it is okay to limit interactions that don't feel supportive as well. I know this is a time of year where there's a lot of pressure to spend time with family and loved ones, but if there are any interactions that really aren't bringing you joy and you leave feeling maybe more distressed or upset, it is okay to limit those interactions during this time and give yourself some space if that feels right. The next part we're going to talk about is just kind of prioritizing. Take time to reflect on what brings you joy during the holiday season and limit the parts of the holiday that make you feel increasingly stressed. For example, if maybe listening to holiday music brings you peace, try to do more of that. If decorating really stresses you out, maybe this year you don't decorate, or ask one of those identified support people to help you with the decoration piece. So just kind of prioritizing what is most important to me this season and what feels good and what doesn't. Look at your calendar and really look at the different obligations you have and maybe highlight 2 or 3 that you know are a priority that you can't miss and you have to attend, and maybe limit others or even cancel plans that are stressing you out. Prioritize what feels right for you this season. And remember, it is okay to cancel plans that are stressing you out. You might feel relieved if you were able to lessen your load at all. So just kind of, reiterating that you should prioritize what feels best for you during this time. And we can't always do everything, especially if we're going through a medical situation. So just upfront, kind of identifying the parts of the holiday that bring you joy and cause you stress may help you prioritize which obligations are at the top of your list. And then just encouraging everyone to conserve your energy. It can be easier said than done, of course, but just planning around your energy levels and treatment schedule if that pertains to you, and maybe knowing which times or which days of the week you're more tired than others and planning around that. Perhaps you want to attend a gathering, but staying longer than 2 hours will drain you. So you decide to go because that's what feels right, but you limit your time there to 1 hour just so you don't feel completely exhausted once that gathering is over. Just really paying attention to your body and signals and resting when you feel fatigued can be very helpful. Pushing yourself beyond your limits can lead to increased exhaustion and burnout. So we don't want that. We want to try to find a balance that feels right for you and your unique situation. And it can be really helpful to schedule some rest periods during the day, maybe every day after you have lunch. You know, if you have the ability to do so, you schedule 30 minutes to just, you know, rest and really take that time to just do nothing. And yeah, so that's kind of a big one, conserving your energy so you're able to get through the season and feel your best. And then this is a big one that I talk about with patients quite often, which is setting boundaries. Some of you may know what that means, others may not. So setting boundaries is really setting limits and guidelines to establish and maintain our personal, emotional, and physical space. So we really want to try to set boundaries throughout this season. So again, we don't burn out and can feel our best. Understand your own limitations first and then set realistic expectations for yourself. For example, maybe this looks like letting family and friends know if you don't want to discuss your diagnosis or medical situation during the holidays and letting them know up front, you know, I have been talking about this a lot or thinking about this a lot, and it's just something I don't really want to discuss when we have our holiday meal. Telling loved ones in advance you may need to cancel plans if you don't feel well, so there are no surprises if you need to cancel last minute. Setting boundaries is essential for your own well-being during the holiday season, so just keeping in mind to communicate openly with your loved ones, be kind to yourself, and allow yourself the time and place you need this season. And this is just a little about engaging in meaningful activities. And again, this might look different for everyone. We all find, you know, joy in different activities, but just remembering that you can find joy in very small activities. It doesn't have to be big travel plans or anything elaborate. A very simple activity can still bring you joy and peace. Perhaps you can find a small nugget of joy in reading a good book, listening to an uplifting song or podcast, enjoying a warm cup of coffee or tea, practicing meditation or relaxation techniques, talking on the phone, even just taking 10 minutes of quiet time for yourself. So I think sometimes we think finding a meaningful activity has to be something big, but it really doesn't. You can find peace in many little things throughout the day. Finding joy during the holidays while facing a medical situation may require some adjustment, and it may not be the usual activities you were used to doing. But over time, I think that you can definitely find maybe things that still, you know, bring you joy in different ways. Maybe you used to go on a run and that would be a meaningful activity, but maybe now it's going on a short walk or just sitting outside and enjoying nature. So just finding what adjustments work best for your situation that you can still find joy within. And a lot of patients do have questions around the holiday season about different gatherings or travel. So it's always a good idea to talk with your medical team in advance. Some questions that come up are, can I fly? Can I adjust my appointment date to visit with my family longer? Can I join large gatherings while undergoing treatment? Can I eat certain foods? So your medical team just knows your unique situation best and can really guide you best on these types of questions. So it's always good to talk to them before the holiday season so you can prepare and make plans accordingly. So that's a big one that does come up with patients. And this one's just about practicing gratitude. It can feel really hard to practice gratitude when you are facing a stressful time, but gratitude can allow us to acknowledge, notice, and appreciate positive aspects of life that are still present. And again, these can be very small things. It doesn't have to be anything big, but you may have gratitude for something as small as a warm cup of coffee or a supportive conversation you had with a colleague or a friend. Expressing gratitude can really enhance our resilience and ability to cope with difficult situations. Gratitude can also encourage a lot of self-reflection and introspection by allowing us to identify and appreciate the lessons and personal growth that can sometimes come from a challenging life experience. So I challenge all of you to maybe once a week try to find something very small that you're grateful for or that makes you feel good throughout this holiday season and reflect on that. And just, yeah, cultivating gratitude in general can help us maintain a healthier mindset. So it's always a good practice to have in your back pocket. And I just wanted to point out, it's always best to seek professional help if you're really feeling like you are experiencing any mood changes during the holiday season. You can always let your medical team know if you're experiencing these mood changes or ask for community mental health resources. You can also call your insurance provider directly for in-network mental health referrals. But I am one of the social workers, and here at St. John's, we do have our cancer support services team, and we are always happy to talk with patients directly about their unique situations and coping styles and come up with a more tailored approach for what is going on in your life. So I just wanted to call that out. And if you are ever seeking a actual emergency or psychiatric crisis, you can call 911 or present to the local emergency room or call 988, the suicide hotline. So I just like patients to be aware of all those things if at any time you were experiencing a mental health crisis. But here at St. John's, our cancer support services team is always available to speak with you and talk about your personal and unique situation, because I know what we talked about today is rather general. And that gets me to if anyone has any specific questions for me or about the services that we offer here at St. John's.
I wanted to say that I don't really know anything about the services that you're talking about at St. John's. And maybe you could give me a little idea of what's available just on a general basis.
Absolutely. So yeah, I'm one of the oncology social workers here, and we have a department called the Cancer Support Services Department, led by our psycho-oncologist, Dr. Garanathan, who is a psychiatrist. And as social workers, we can meet with patients one-on-one to provide short-term supportive counseling that is typically focused around your medical situation and obviously other stressors that come up. So we meet with you one-on-one to do that for a short period of time. And if we also provide community resources, say you were looking for a support group or we're having any financial distress, or we're looking for private caregivers or, different support resources within the community, that's when the medical team refers to us and we are able to help with any of the mental health concerns or general community resources. And then we would defer to our psycho-oncologist if there was any questions about mood medications, or if you felt that even though we were having supportive counseling sessions, you still were having ongoing sleep issues and increased anxiety or depression. So really, we work as a team to get patients the mental health support that they need, because we do recognize a lot of distress can come up throughout medical diagnoses, as well as adding in these other factors like the holiday season and just life. So we are always here to consult with you and come up with a tailored plan that would help fit your needs.
That's very interesting. Thank you.
Absolutely.
Any other questions for Caroline?
No, I just wanted to say that a lot of these things are very familiar, the things that we talked about today. And I'm surprised at how many kind of unconsciously I have already done, how many adjustments I've made in my lifestyle and just my daily activities because of fatigue and that sort of thing. But there are some things too that I have really not given much thought to. I think the gratitude is something I need to work on, and I'm glad that you brought that up, because I think that's one area that we could all use a little help in.
Absolutely. Well, if you have any other questions, my email is here and I'm happy to talk more specifically about your situation. But yeah, I think gratitude is so important. And I even always need a reminder to kind of step back and find something small that we are grateful for, because we can go day by day and not always do that practice if we're not mindful of it. So I'm happy that resonated with you.
I think many times I tend to focus on the negative. I'm glad somebody's giving me the opportunity to focus on the positive. Thank you.
Absolutely.
Caroline, I think you've given us a lot of food for thought. And what I really liked is the review and reminder that we need to be mindful of our own expectations and set an intention about reflecting and taking care of ourselves. And I always go back to that story of the airlines and the oxygen mask and putting it on yourself first. And I think it's very hard for us, especially during the holidays, to remember to do that without fear of guilt or recrimination in some way. So.
Absolutely. Well, yes, I think this is a good reminder, and I hope we can all practice some of these things throughout the upcoming holiday season.
Yeah, so thank you very much. Can you advance to the next slide, please?
Yes.
This will be available on the web, and I think is one that we should remind people to listen to again and again. It's a great overview, not only for the holidays, but throughout the year. And just we will have this posted probably within a week to 10 days, so it will be viewable on the website again if you want to review it. And then a reminder that in November and December we are on vacation from the Health and Wellness series because it's too close to the holidays when we're scheduled. But in January, I believe Joseph Greenberg, another one of our social workers, will be addressing sleep. And he did this in the summer for us, but we didn't get it recorded. And it's a really good presentation. And we have some other speakers we're lining up for 2024. So we hope you'll return. And I think we'll end the recording. And then if there's any dialogue that you want to continue, we can do that.